حبيبي 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 يا نور العين يا سلام.
تعالي تعالي.
الله عليك الله.
ما سمعتوش حد فيكم غنى طيب ولا اي حاجه؟ احنا كل مره هي اللي بتكرمنا، فالمره دي جايب لها معايا من مصر. It's a unique gift. It is the logo of Kaaba. Okay? This is so Egyptian. In Egypt, we used to make the cover of Kaaba, the house of God in Islam, in our religion, and we always used to do it. So this is the look of Kaaba, jewelry, Egyptian-made silver for you. We will talk about PLLA cube, and Mansour will come and start the presentation. Please welcome Dr. Kim.
Hello. Hello. Mic, please. Okay. Hello, everybody. I'm from South Korea. My name is Kyungmin Choi, and I'm a CEO in Levin Cube Company, manufacturing PLLA cube from South Korea. And I'm also the professor in the Chemical and Biological Engineering Department in Sungmyeong Women's University in South Korea. Maybe I'm the only engineering presenter in this room today talking. Today I want to show you the science behind PLLA cube, which we call as Black Cube, which is the reinventing athletic actives with the 2025 Nobel awarded chemistry for superior outcome and the safeties. So the problems, we focused on the inflammations, and the interest we had is how to make safe filler or medical devices. So the problem was that the rejuvenation paradox. So our question was acute inflammations. Is it really necessary for generating the collagen? So most of the conventional collagen stimulations and the rejuvenations works via inflammation pathway. Usually, they follow this kind of inflammation pathway, and there is always acute or large amount of inflammations in the initial period of time. So we believe that we should reduce the inflammation in this area, and we should control the inflammation to be like this, to be moderate, so that we can prevent the side effects such as the nodules and granulomas and edemas, something like this one. So we believe that rejuvenation should not require the excessive inflammations, but create the conditions for sustained remodeling. So this is our visions when we developed our PLLA cube. So we wanted to make our dreams true by using our core technology, which we call as Cubrix. Cubrix is our own technology, making space inside of materials and control the space of the materials from the angstrom scale, nanoscale, and micron scale. So today, in the following page, I will show you how we developed Cubrix angstrom and the nano, micron, and use them for developing our PLLA cube product. So let me first start from the Cubrix angstroms. So Cubrix angstrom make a space or molecular space protecting ingredient inside, such as vitamin C and the glutathione. These products are very weak, and they are deteriorated easily even in the production process. So once we encapsulate by our Cubrix angstrom technology like this, and we can make them stable in the sterilizing process and the distribution and the storage period. So as you can see here, our product maintain their efficacies when they are delivered to the patient. So this is our paper proving the efficacy of the vitamin C encapsulated. So in our paper, we proved that the efficacy of the vitamin C was maintained up to 200 days. And once we combine the vitamin C protected with the PLLA particles, so we can control the level of the inflammations to be moderate, as it's shown as a red bar here. The blue bar shows a conventional PLLA making an acute inflammation, but once we combined with our protecting technology and the vitamin C and the glutathione, we can control the level of the inflammations. But at the same time, we can accelerate the collagen generations. The second Cubrix technology is nanoscale. So in the nanoscale Cubrix technology, we can control the space of the particles, so we can prevent the particle aggregations, which is one of the most often reason of the adverse side effect. So if you see this picture, this is a Cubrix engineered PLLA, and all the particles are homogeneous, and they are all separated. They cannot be get together. But conventional PLLA particles, usually when they are hydrated, they can get together and get clusterized, and that could be the main reason for the inflammations. So in different paper, we proved that the Cubrix engineered PLLA particles, they are existing all separated. And then their dispersion was doubled comparing with the conventional product. And it also suppressed the inflammations in the initial period of time. But at the same time, they accelerated the generation of the collagen. And the last Cubrix technology is microscale, which provides the pathway or space for water diffusion pathways. So it makes the ultra-fast hydration for user convenience and enhance the safety. If you consider usually conventional material require at least 4 hours or several days to be hydrated to be dispersed very well, our product only required 4 minutes to be ready. So it can minimize exposure-related risk that can contribute to the inflammations. So we have the 3 different regimes of Cubrix technology. In the Armstrong level, we protect the vitamin C. In the nano level, we control the particle distance. And in micron level, we can provide the pathway for water diffusion. So we combined all these different regimes of technology in our PLLA Cube product. So we first launched the PLLA Cube Original and then Pinkable. And this year, we also launched the ExoCube and PDO Cube using the PDO particles. And our product is now available in 32 countries, and we have 8 related scientific papers and 14 related patents. Thank you very much.
Yes.
Now I want to invite Dr.
Thank you.
Yes.
Thank you
Thank
so
you.
much. Yes. This was the scientific part. Now let's go to scientific, but in another way, more practical for our use in our clinics. Okay. I won't know how many of you attended a lecture for me before for MAB. How many of you? كم حد حضر MAB قبل كده? Okay. Right. This patient was injected filler once in her life, and this is her after 3 years. And the rest is the MAB. We will understand what is MAB later on, but let's see her photos. Yes, her nose is better because of the rhinoplasty, a part of rhinoplasty, but look at the face. Maintained results for 3 years. Another case, look at hair. This is before, and this is after 18 months of the MAB. Really? One filler injection, only one session of filler injection, and the rest is the MAB. Look at these cases, the same. Was injected filler once, and the rest is the MAB. Look at the neck. Look at the skin. This case is a very hard case to inject. When she comes to your clinic, what would you do? You will tell her, do surgery, right? She have a very heavy face. Can filler or threads hold all this? No, but MAP can do this. You can see all angles of the case from all views. MAP protocol, yes. She was injected filler once, about 13 ml, and the rest is MAP. Okay, now you keep telling us MAP, MAP, MAP. What is the MAP? The MAP is codes, score, technique, and protocol. This is our main 4 sections of the MAP. Codes is the anatomical codes of the face. Score is the assessment score of the full face. Technique is the injection technique. And protocol is the treatment protocol. But because we are here talking about a biostimulator, so we are talking about PLLA cube. It's not like any PLLA. It's a mix of PLLA, and some other materials would give you better effect and better results, immediate, and till the PLLA really works after 1.5 months. Vitamin C, glutathione, hyaluronic acid, exosome, BDRN, we all have this in our clinic. We all use it. But when it mixed with PLLA, it's totally different. It's all in one. All you need in one product. What's the risk of PLLA? Granuloma, right? But why? High concentration, irregular shapes, deep injection in boluses, and insufficient dilution, right? PLLA cube solved all these problems. How? Low concentration of PLLA, spherical shape. Regarding deep boluses, we do a lot of trainings worldwide to teach all doctors that injection should be linear, retrograde, no bolus. And finally, we have a dilution protocol for the dilution. But you told me low concentration PLLA, so it's a weak product, right? No, it's not, because we add a lot of extra materials, glutathione, and hyaluronic acid, exosome, BDRN, vitamin C. We have a lot of products in one product. So it's a PLLA, but in a safe form. The dilution is very easy. As you see yesterday, the dilution, we already did it in 2 minutes, and then rest, another 2 minutes, then rest, and so it's total 4 to 6 minutes. So you don't need to shake a lot, you don't need any of this. And now, it's time to know the MAP sessions. In this part, I need you to take a photo of this to be a guide for you in your practice. After we do fillers, threads, or surgery, any of the lifting procedures we do in our clinics or in the hospital, it's followed by a session of PLLA or calcium hydroxyapatite, whatever you want in your practice. Then, after 2 months, skin booster, whatever the skin booster you have, which I prefer today. We'll talk about LOLA and RRS, higher left. Then you can use laser machines or any machine in your practice or in your clinic. And then you will repeat this through the year. So each 2 months, a session. If the patient cannot afford, let's make it 4. So you have 4 to 6 sessions. But some of you here fan of PLLA, right? What if we use PLLA cube? What is the interval? 4 times per year, every 3 months. And if you are a fan of Norok Pharma, like me, why can a doctor be a fan of a distributor or a company? You know how? They support, they teach you, they bring you best products. I stopped using very good products in Egypt because they have a very bad distributor. And I worked with medium products in Egypt, but the distributor is very good. What we need in our practice, someone to be behind our back. Someone, when you have a problem, you call them, they bring you the best experts in the world to either teach you or solve your problem. So the distributor is very important. In case you fan of Norok Pharma like me, after you use fillers in the MAP protocol, you can use Lola, RRS, and higher left topical only 2 weeks after injection. Then, another 2 weeks, we do PLLA. Can we do injection after more 2 weeks? No, never interrupt the process. So you would go for 3 months, wait for the process of collagen stimulation and collagen reduction, then start again RRS or Lola, then you go for PLLA and repeat with your machines or whatever for the rest of the year. And now we talked about all of this. Before I start this video, let's have a quick chat together. What is the uses of PLLA? Can you tell me? Yes, where? In the body, face, neck, décolleté, hands. Anywhere else? Cellulite. Let me tell you, very nice place to inject PLLA cube, buttocks, but little, it don't do lifting. Lifting, send her to us. We will do surgery, and it's not, it will don't do any lifting, but it will give a better skin quality. Okay. So let's discuss the face. When this patient comes to your clinic complaining from the face, the jowl, the falling of the face, what would you do for her? You go directly for PLLA? No. We need to start with fillers first to lift the face, as you can see here. This is the case, and this is her after 3 months. Although she have a very heavy face. And you know, in your practice, it's a hard case to inject. So before we start, we need to know the aging, how the aging happen. To know the MAP protocol and treat it well, you have to know every layer of the face. For sure, all of you know each layer of the face, but you have to know the importance of each layer so you can treat all these layers, because it's MAP, multi-layering anti-aging protocol. We need to treat each layer of the face, like deep plane facelift. We don't do regular facelift anymore. We do deep plane facelift of the muscles and the ligaments. For example, skin, we need to treat the elasticity, firmness, fine lines, wrinkles, pigmentations, and skin tone. Used materials can help in this. Regarding subcutaneous fat, we have deflation, a lot of volume, and the most important part, loss of continuity of facial compartments. Mass and muscle, which is very important for the dynamic wrinkles of the face and pulling the face downward by aging. Either machines, even PLLA, we injected near the tendon because we have fibroblasts in our tendons. So we need to stimulate collagen there too. Deep fat compartment the same. Ligaments is very important part of the face, have a lot of fibroblasts when you stimulate it by products like PLLA or whatever the product you have to stimulate it, you will have a tightened face. And finally, the bone. We need to camouflage and treat the bone resorption by fillers or whatever the material you have. So,
injection process start with patient psychological assessment. This means the beauty from her perspective. And now it's time for assessment, my assessment, our assessment. How to assess the patient, the aging, the problems here, and every anatomical part of the face. Our beautiful patient today came to me complaining from the tear trough area, nasolabial, marionette line, and jowl. To assess the patient and to understand the problem, we need to know what happens in aging. Loss of fat, drooping down of fat, made our jowl, and which we call inferior jowl and superior jowl, which creates the marionette, and the nasolabial part, which made the nasolabial depression, and descent of fat and deflation of fat from the tear trough area to medial cheek. This was our frontal view assessment. And now it's time for side or lateral view assessment. As we can see here, all the fat descends down, either from tear trough area or from the cheeks, which made our nasolabial fold, marionette lines, and the jowl. When we treat all of these areas and we do lifting for her with my technique, she will have a better balanced lifted face. Yes, it's a challenging case, heavy skin and heavy face, which will be treated with the MAP technique. And now it's time for the anatomy. We'll start with the most important parts, which is the dangerous areas of the face. To understand the dangerous areas, we need to understand the courses of the vessels in the face. Facial artery, which comes from external carotid, comes in front of the masseter, then bas tortuous here in front of the angle of the mouth, then coming from the piriform fossa, continues as angular, giving lateral nasal artery, and superior labial and inferior labial. And don't forget that columellar arteries coming from the superior labial. And here the external carotid continues as superficial temporal artery. Sometimes in some patients with variations, we have transverse facial artery. About 2 centimeters from the midline, we can find supratrochlear foramen, which gives the supratrochlear artery. And 3 centimeters from the midline, we can find the supraorbital foramen, which gives the supraorbital artery. Both of them starts deep, then goes superficial. And down here, also another 3 centimeters from the midline, we can find the mental foramen, which gives the mental artery. And the last important foramen in the face, infraorbital foramen, which is in the mid-pupillary line, which gives us the infraorbital artery. Ligaments play an important role in our technique. That's why we need to address the ligaments, which separate the face into rooms. To understand these ligaments and these rooms very well, you will never have migration of fillers. And the ligaments of the face, from upward to downward, temporal septa, orbital retaining ligament, zygomatic cutaneous ligament, masseteric cutaneous ligament, mandibular ligament, and mandibular septa.
We've completed the assessment. We understand the anatomy. Now, it's time to inject. But before we inject, we must set a plan. And that plan is the MAP protocol. What is the MAP protocol? MAP stands for Multilayering Anti-Aging Protocol, developed by me. Yes, it is an aesthetic procedure. But more importantly, It is a comprehensive, full face treatment strategy. Because aging does not happen only on the skin. It affects every layer of the face: the skin, the fat compartments, the muscles, the ligaments, and bones. The philosophy is simple. Every layer must be treated strategically and precisely. Each product, each device, carefully selected, based on scientific evidence and years of clinical experience. Through the precise injection approach known as the MAP technique, developed by me, patients achieve a naturally lifted appearance without overfilling, without unnatural augmentation, only harmony. Results typically last 12 to 18 months, but when patients fully adhere to the MAP protocol plan, results can last for more than 36 months, with the face appears more youthful, more revitalized, fresher, naturally balanced. The MAP is not about adding volume. It is about restoring structure, treating every layer, rebuilding harmony, and achieving long-lasting, natural results. Now, let's begin the first step of the MAP protocol, the MAP technique. A strategic, multi-layered injection approach designed to restore structure, support, and natural facial harmony.
Now it's time for fillers. So when we inject, we have to know the levels of injection. This is the superficial subcutaneous level. This is how you see your cannula. And now, more deep, the lowest layer of the fat, the first layer of the muscle is the intermediate level. Finally, the supraperiosteal, deep supraperiosteal, you cannot see your cannula at all. So now you can know where you are. We start by lifting the face from the lateral part, from the zygomatic arch, which I call it skin tension reloading. We reload the skin on a different layer. Then go deep on bone to support the tissues, which I call it deep tissue support and myomodulation. Last point would be the piriform fossa, 0.1. Rarely I inject it in my cases. Let's go to the lower face. Just one opening above the dow. We go directly to the chin from both sides. I can reach the chin from both sides. I can inject deep on bone and superficial. So it's multi-layering. So it is MAP. Let's go lateral to the angle. Superficial injection, you can see the tip of the cannula. I'm running through, perpendicular on the jawline. I don't go parallel to the jawline, perpendicular injection. So my filler would be here. I don't want to give her more chubby face. She already had one. Marionette and premental depression would be addressed superficially. Filler suppress the action and the power of the muscle of the dow. So it would give her more lifted face. So it's too many techniques, and the aim is one aim, is a lifted, contoured face. Now I'm doing a quick touch-ups. These touch-ups for the components between the face, between the superficial fat compartments. It's a touch-ups either superficial in this part or deep if I want, but it's mainly superficial in this area. Can you see my hand here? The non-dominant hand is working more than the dominant hand. Look at the face, look at the hollowness, jowls, fullness of the face. Look at the angle of the mouth. Look at the other part, more lifted. Better. Lifted. And this is here after 3 months.
The second step of the MAP protocol is multi-layered biostimulation and biorevitalization, strategically delivered at the deep, intermediate, and superficial levels, because true regeneration must happen in every layer of the face.
In this part, you can use Lola from Morocco Pharma, RRS long lasting, or RRS high lift, or any product you believe it can give us a stimulation. The same technique, the same opening of the filler injection. 1 point, easy, you can reach all the face. Unless you want to inject, you will open another openings from above, or the chin, you will open in front of the down. After 2 weeks, you can use PLLA as we mentioned in the time frame. You can go like what we did yesterday, either deep with pink or superficial with blue. The next step in the same session of the RRS long lasting, but I put it after because it's have a certain explanation alone. Yes,
Step 3,
this part.
Direct intradermal skin quality enhancement, improving texture, refining pores, enhancing hydration, restoring glow,
Intradermal
unifying
injections.
tone.
So I'm addressing
Because true
all the
rejuvenation
layers of the
must
face.
also be visible on the surface.
Even the neck as well. Although she don't have a problem in her neck, but later on, if I keep working on her face, leaving her neck, she will have a young face and old neck. This injection, intradermal injection, is not PLLA. It's skin boosters, whatever.
Step 4,
like
strategic
RRSIs or
topical
whatever.
therapy, masks, creams, serums. In the fight against aging, every weapon matters, and precision wins. Step 5, intelligent integration of energy-based devices. Never overlook the machines in your clinic. They play a powerful and complementary role, but use them wisely. Always respect timing. Always respect sequence. And carefully align every device with your injectable strategy.
Before we go to the next part, I want to invite a doctor I injected here yesterday with PLLA cube. I know that you know that PLLA gives you some edema after. But look at her. If you guys know her before, I don't know if you know her or not, but look at her face. Is this a face was injected yesterday? No bruises. No major edema. She looks fine. She have nothing done. She can go out, she can enjoy her life. This is what we want to give out to our patient. We want our patient to go home feeling safe. She did nothing, right? مبسوطة؟ الحمد لله. اتفضلي. طيب. Next, we showed MAP technique. And in the last session today, before the gala dinner, I will be discussing more about MAP technique, but a real injection. But let's see, MAP technique works well for men in different ages. MAP technique works well for women in 40s. Also working well in women in 50s. and in 60s. MAP technique is working for women in 70s. And finally, the take-home message is don't forget the love in your life by focusing on conferences and work every day like this lady. And the last and most important take-home message is MAB is safe, easy, and effective. Aesthetic medicine is don't meant to be complicated. Don't do like this one. It's easy. And thank you. Any questions? Yes? We were injected. They saw the injection. It's the same. It's the same. We have 5 minutes. Do you want to inject? Do you want me to inject or questions?
Questions.
If you want questions, raise your hand, please. If asked to proceed with questions with doctors, I see, look, discussion would be better and beneficial. We have 5 minutes. Very good for discussion, right? Okay? Injection? عايز injection؟ خلاص عشان خاطرك. ماشي.
Excuse me, please.
حاضر. هانجكت. أنا كنت بقول إن إحنا نعمل discussion. فخمس الأسئلة مع الحق. ماشي تمام.
I have a question.
Yes, sure. Where?
Here.
فين؟ حبيبي.
Here. So it's more about engineering question, not practical. I mean, the question is for the scientists.
Okay.
You know, I will play as your advocate, you know. For example, if I've heard a lot about your product, why it's not really concentrated with PLLA? You know, other products, they are 135 milligrams. This is the bulk. You just have 80, 90 milligram. So, I mean, if you have studies that shows that with this less quantity, you have more efficiency or as the same efficiency. I think if you just explain that to people, I think they will be more into your product. I don't know if you understand my...
Yes, I fully understand what you mean. And the amount of PLLA in PLLA cube is smaller than other product. That's because each particle have a higher efficiency than the particles inside of the other product. And what we believe is that we don't need to use a large quantity of PLLA to boost up, but we should use the marginal or just the proper amount of the PLLA to boost up your skin. Because we have the antioxidant like vitamin C and the glutathione and the other ingredient, and those ingredients can boost up the function of the collagen stimulation of the PLLA. That's why we have the smaller amount, and it's more safer, and it can prevent the side effect like granulomas and edemas, something like that. Is that, can be this answer for your questions? Yes, as I show you in in our paper result, the collagen generation result is almost doubled comparing with the conventional product. So that's why we have the smaller amount. It is enough to boost up your skin. Yeah.
Injected anywhere. Forehead, temples, anywhere you have a skin or fibroblast, you want to do it, yes, you can do it. We have blue for superficial, and you have pink for deep. And by the way, pink, we can inject it superficial, by the way. You can do so. But blue is preferred by the company, and anywhere you have a laxity and you have the need, you can use the product.
Okay, thank you very much.
Sure. Pink and the blue is synergistic effect. You can use only blue or pink, but if you want to have a synergistic effect, in MAP protocol, we have too many products, too many machines. You have a lot of products to use. Use them all. Everything. I used Lola and other products, okay? And I used, I think, NAD Plus for the skin. The intradermal injection was NAD Plus, I think. PLLA Cube, too many products. Yes, yes, yes. The one in the video, right? Yes. Yes. No. Yes, pink and blue, yes, you can use it for the neck. I recommend blue. I recommend blue. As long as you're injecting superficial. We don't want nodules in the neck. By the way, the worst granuloma in the neck. The worst granuloma, we cannot get rid of it. I have patients, they did a deep plane face and neck lift to remove granulomas, and they couldn't remove it. Take care. So using blue is safe. Using PLLA cube is safe.
For body indication, we can adopt
Pink is the best for body.
ink
Yes,
and
strongly.
the same protocol.
No, I
3
don't
months or-
inject deep in body. Injecting body only superficial. Hand superficial. Body superficial. Buttocks superficial. Décolleté superficial. Anywhere else superficial. With pink, no worries. Yes, it's very thick skin. You will never have granuloma.
And when can we repeat the injection of the
3
pink?
months.
3 months.
Yes, 1.5 months for stimulation of collagen, for collagen to go up, and another 1.5 months to go down. So respect this.
Thank you.
What else? Done? محتاجين مني حاجة تانية؟ تمام؟ شكراً.